But in one of your videos on your website, I saw one of your frustrations in your early training, I guess when you first became a veterinarian, was in the traditional path, you felt that the diseases were only to be managed rather than be quote unquote cured or at least improved. And I think you were talking about diabetes before. That's one that really jumps out to me because the food that gets prescribed or most of the diets you'll find are not really about getting to the root of the problem. They're just about slowing glucose, the flow into the bloodstream.
Yeah.
What do you do for you have a patient come to you, the dog is diabetic. You recommend raw? Do you recommend low carb? Do you recommend ketogenic? Do you work with, I know some must be on insulin, but it's one of those things that and chronic kidney disease really hit me crazy because most of the things out there are not about improving their lives. It's just about, let's just manage the symptoms with medicine. So what is your approach in these cases?
Okay. Yeah. Okay. So the video that you've seen is that I went into veterinary medicine after 6 years at vet college, and I thought, this is great. I know everything. Yeah, I was young then, Vincenzo, and I thought, this is great. I'm a vet. I can make animals better. But there were so many animals that you didn't make better. You just kind of kept on seeing them. And I was really disappointed in that. My mother was a nurse, my father was a doctor, and so I had some background in medicine, and they were very holistically minded, and therefore I knew that there was a much broader way to approach disease. And also, I very much know that if you have a disease process and you just treat the disease and you don't look at causal factors, you're likely not to cure that disease. In veterinary medicine, at vet college, they say they will tell you 80% of every dog who walks through the door will get better on their own. Okay, so we're not talking about those guys. Okay, they just need a little bit of help. And if it were me, it would be some herbs, homeopathic, probiotic, maybe just some education. Mrs. Jones, Bruno's going to be fine. Yeah, just give it some time. Maybe just feed some light food for a few days. Let me know in a week. Okay, maybe that's all it is. Okay, and I think vets are scared to not give anything. Yeah, usually you go to the vet and you come out with at least two prescriptions. Yeah, and a bag of food. Yeah, that's very, 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 very typical. Okay, and that's a real shame because sometimes all you need, you just need to say things are going to be fine. Yeah, this is what's happening. Let me explain. This is how the kidneys work. This is what we need to do. We're just going to do and we're going to see, and then we'll do some tests in a couple of weeks. Okay, so sometimes that's all it is. And so, coming back to your question was, yes, I was frustrated that there were so many diseases that we were just managing. And diabetes, for example, I think it's impossible to treat diabetes if you're feeding high carbohydrate kibbled food, which is basically everything on the market. Everything on the market is between 30 and 60% carbohydrate. Carbohydrates are insulinogenic, which then promotes diabetes. The difference between dogs and cats, dogs get type 1 diabetes, which is in humans is usually young age disease, where your pancreas just stops making insulin. Okay, that's what dogs get. Cats, they do what humans do, and they get type 2 diabetes. Insulin resistance is this older age diabetes, and it's often due to overweight, too much insulin. And if you can lose weight, then you can, just by doing that, you can normalize, especially if you go onto a raw food, low carbohydrate diet. So with dogs with diabetes, type 1 type diabetes, a raw food diet is really important. And I've recently had a case, and this was an older, she was a black Labrador bitch, and she was on 4 units of insulin, and yet her insulin levels were between 20 and 30 still, even on 4. She couldn't take any more than that, and so that was it. And so what we were able to do using the a raw food diet and some herbs and some homeopathics was we were able to get her normal level no, I'll give you the insulin. We were able to get her insulin down from 4 units down to 1. We haven't been able to get her off, but that's a fantastic improvement, because insulin is it's a growth hormone. It has many other effects, side effects within the body. So the less you take, the better that is. And her average blood glucose came down to between 10 and 20. So still not right, but half of what it was on a quarter of the insulin dose. And the mainstay of the treatment was by changing her diet. And there was some herbs which we worked out for her specifically.
Yeah, that's incredible. And that's I'm happy to hear it, because I don't think most people know how much diet can impact what's going on inside their dogs. And you talked about carbohydrates and how most foods, I mean, I've reviewed a lot of kibbles, a lot of commercial foods. I think I've seen 3 that have a low carbohydrate count, and one of them is a ketogenic diet dog food. They're few and far between, and even those end up getting bought by one of the big companies, and what was a low carb dog food starts to have peas and lentils and corn starches and things. So
yeah,
they get prescribed these foods that are full of carbohydrates, and they don't understand why the problem's not getting better. Like you said, you're going up in insulin units, and eventually you reach that point where there's nothing else to be done. And then, I mean, I think a lot of dogs unfortunately have been put down when they could have been helped over the last probably 70, 80 years. And it's getting better now, as you said, but it really makes me sad to think about just how many times that happens.
I agree.